Hello, my name is Gabriella Ambrosi, and I am the President and CEO of Sequoia Senior Solutions. We provide in-home care for the elderly, and many of our clients are affected by Alzheimer's disease. Last week, we discussed how to deal with aggressive and challenging behavior. Today, we will talk about management of hallucinations in your loved one with Alzheimer's disease and how little changes in the environment can make a difference. Hallucinations are false perceptions of objects or events and involve the senses. These false perceptions are caused by changes that occur in the brain. Some people with advanced stage of Alzheimer's disease may be affected by hallucinations. Your loved one might see the face of a friend in a curtain, for example, or may see insects crawling on her hands. In other cases, a person with Alzheimer's might hear someone talking and might even engage in a conversation with an imaginary friend. A person with Alzheimer's may also taste, smell, or feel something that isn't actually there, and these also are considered hallucinations. If your loved one with Alzheimer's begins hallucinating, it is important that she is seen by a doctor to rule out other causes for the hallucinations and to determine if medication can help. Ask the doctor if perhaps the medications your loved one is currently taking might be the cause of the hallucinations. There are changes you can make in the environment to prevent or at least minimize the occurrence of hallucinations in your loved one with Alzheimer's. Decrease the number of objects in the house that can be misinterpreted as something else. Increase lighting so that there are fewer shadows while avoiding glare. Remove or cover mirrors if they cause problems. Your loved one might not recognize herself in the mirror and think that another person is there. Ask your loved one where she sees the thing or person and make changes accordingly. A dark tile on the floor, for example, might appear to a person with Alzheimer's as a bottomless pit. Covering the tile with a rag can solve the problem. Avoid letting your loved one with Alzheimer's watch disturbing programs on television. Don't argue about what is real and what is fantasy. Discuss your loved one's feelings relative to what he thinks he's seeing. Respond to the emotional content of what your loved one is saying rather than to the factual and fictional content. Some of the suggestions that we discussed in previous videos on how to successfully interact with a person with Alzheimer's also apply when it comes to hallucinations. For example, distraction, refocusing her mind on something else. You might say something like, "Okay, I can understand how you feel about seeing that, but let's go work in the garden now." Once you've changed the person with Alzheimer's location or have introduced a new activity, the hallucination often fades. Reassure. Let your loved one know that you are there for her, offering kind words and a gentle touch on her hand or arm. This can turn her attention to you and away from the hallucination. If your loved one is suffering a delusion about money being stolen, for example, you might reassure her by allowing her to keep small amounts of cash in a purse or pocket for easy inspection. Be honest. If the person with Alzheimer asks you about her hallucination, respond with honest tact. You may say, "I know you're seeing something, but I can't see it myself." Don't reinforce it. Don't argue it. Just acknowledge it as a concern and move on. Accept the fact that Alzheimer's is a disease of the brain and understand the brain-behavior relationship. Be non-judgmental. Ask family and friends to step in or take your loved one for an outing. Get respite care. You can either hire professional in-home caregivers or you can look for a specialized Alzheimer's facility that can provide respite care for your loved one. In the end, remember, you must take care of yourself so that you can take care of your loved one. This concludes my series on how to care for a family member who has Alzheimer's disease. I hope you found the tips I gave you to be useful. Please feel free to visit our website at sequoiaseniorsolutions.com or call us at 707-763-6600 to find out how we can help you care for your loved one. Thank you for your attention.